Our second lecture is about physiotherapy management in post-platelet-rich-plasma for knee osteoarthritis. Assistant Professor Dr. S.M. Mustofa Kamal will talk about it. Dr. Mustofa is an assistant professor in physiotherapy at SAIC College of Medical Science and Technology, Bangladesh. In addition, he teaches research and supervises undergraduates at the University of Dhaka and provides his services to many local and international organizations. He had done research on the efficacy of PRP therapy along with physiotherapy for the management of knee osteoarthritis and was awarded as an international inspection specialist for joint injection courses and PRP therapy course by Monroe Medical UK. I would kindly invite Dr. Mustofa Kamal to deliver his lecture from Bangladesh.
Hello everybody.
Hello everybody. Me is Mustofa Kamal from Bangladesh. Thanks to the organizer and to the Sri Lanka Society of Physiotherapy. So this occasion is on the World Physiotherapy Day celebrations. So I'm very glad to have this place to share something about physiotherapy along with PRP also. So thanks to the organizer team and a special thanks to the president and secretary and Dr. Kumar also. So now I am sharing my screen here. So can somebody tell me, is my voice is audible and my screen is visible to you?
Yes, sir, we can hear you, but we are only seeing your face, your screen, but not your laptop screen. But it's our logo is there. Is it your screen, sir?
Yes,
okay,
yes,
so,
yes.
So we can see your screen, sir. Yeah.
Physiotherapy management of post-platelet-rich-plasma, PRP for knee osteoarthritis. So currently I am working as the assistant professor at the SAIC College of Medical Science and Technologies. And also I am working globally to provide some international accredited courses. I'm a licensed trainer from the UK. The Monroe Medical is my associated organizations. Also, I'm working as a chief instructor of Academy of Physiotherapy. So what is osteoarthritis? As we all the professionals here and some students may be joining. So we know about the osteoarthritis. The motto of this year, the World Fit Days, was the osteoarthritis. So knee osteoarthritis is a type of chronic degenerative arthritis, and its chronic inflammation is characterized by degenerations or loss of articular cartilage, articular margin, and subchondral bony regenerations also. And if we look for the epidemiology of osteoarthritis, around the world, the 520 million people are suffering with the osteoarthritis. And the osteoarthritis is a chronic disabling conditions that affecting 10 to 15% of adults over 60 years of age. That means this osteoarthritis is more vulnerable for the older people. And 60% of osteoarthritis affecting commonly to the knee joint. And if you see the prevalence of symptomatic knee osteoarthritis is approximately 10% in men and 13% in women. That means the women are more vulnerable for the osteoarthritis rather than the male. So among the 291 conditions, osteoarthritis is 11 conditions which leads disability. So it's a global burden. So I'm talking about the global burden. So till 2017, the prevalence of disability due to osteoarthritis is 9.6 million. So from 1990 to 2019, worldwide prevalence rate of osteoarthritis has increased tremendously, and it's now is 48%. So it's a very, very concerning issues for the upcoming world populations also. So expenditure for the care of persons with osteoarthritis are approximately 15.5 to 28.6 billion per year. So it's really a global burden for our health economies. So etiology and pathogenesis of osteoarthritis. So currently, age, diet, trauma, obesity, and inheritance are the main risk factors. So if someone is growing, someone is getting aged, the older people are more commonly affected. So they may develop the osteoarthritis. Diet. So as with somebody else, if live with the sedentary lifestyles, so if they are fond of the junk food like this, so they will gain weight and they may develop the osteoarthritis. Trauma is one of the cause, and the obesity, according to the WHO, World Health Organization, if someone BMI is within normal range, they will be feel good. But if the BMI exists, if someone is obese, overweight, they will have the more chance to develop the osteoarthritis. So the articular cartilage layers is worn out, the biomechanical changes in contact with the subchondral bone, and the loss and reduction of articular fluid with the acceleration of the aging process. That means as we are going older, so day by day, our articular surface is getting erodes and our synovial fluid is getting lost. So in addition, with weight gain, ligament degenerations, relaxation, and muscle weakness, degenerative changes in articular cartilage and subchondral bone is happening. So Sorry for the interruptions. Management of ONE patients in Bangladesh. So I use our city randomized control trial and I found the prevalence, I mean the p value is 0.015. So if we use the PRP therapy and if we use the PRP therapy along with physiotherapy, is physiotherapy and PRP therapy is more effective for the management of osteoarthritis rather than only the PRP therapy. So now, what are the aims of physiotherapy? For the care of osteoarthritis, there are the sequential aims. As we are the physiotherapists, we have to set these aims and we have to try to fulfill the aims also. To educate patients to avoid high impact axial loading. That means we have to educate patients and we have to ensure that the patient is not bearing the axial loading. And to decrease pain, to increase range of motion, and my previous speaker also mentioned range of motion is important. And to increase muscular strength, and to improve physical fitness, to improve gait training also. So what sorts of treatment for osteoarthritis of knee? So if we look for the evidence, we'll found this 4 strategy for the treatment of osteoarthritis is lifestyle measures. So lifestyle measures, what will be in the lifestyle measures, the maintaining a healthy weight and exercising regularly. So as we know from previously that excessive weight may lead to the osteoarthritis, the regular exercise to maintain our healthy weight also. Supportive therapies to make help everyday activities easier. So we have to provide the supportive therapies as people can do the activity of daily living in easier ways. Some medications to relieve or alleviate the pain, and if needed, surgery. My previous speakers, Dr. Chill, that PRP is working on the grade to moderate osteoarthritis, but in case of severe osteoarthritis, PRP will not work. So if we found the severe case of osteoarthritis, so surgery is recommended if the conservative management is failed. So we'll focus on these 4, the lifestyle measures, supportive therapies, medication, and surgery. So look to this images. So it's a guideline developed by the WARSI. WARSI stands for Osteoarthritis Research Society International. So this ORC has developed a guideline for multidisciplinary team. So this ORC is developed by 16 experts. Within that 60 experts, there are 4 different medical professionals who developed this ORC guideline for the management of hip and knee osteoarthritis. So they did some research also in 6 countries, including the USA, UK, Netherlands, Sweden, Canada also. So what were in this guideline? There are many guidelines for the management of osteoarthritis, but among these 12 are the evidence-based. So this 12 evidence-based treatment we can perform as a physiotherapist. So physiotherapy for osteoarthritis of knee. Look the treatment regimen. What treatment regimen we can use as a physiotherapist? The strength training, strengthening, our aim is to improve the muscle strength and to reduce pain. And fitness walking, aerobic exercise, aquatic or hydrotherapy, and some sorts of electrotherapy, including the magnetotherapy also. So what will be the doses about our physiotherapy sessions? So can we give this physiotherapy every day? No, we have to follow a formatted doses based on the evidence. So treatment session will be 6 to 24 weeks, average 8 weeks. So we can provide the physiotherapy average 8 weeks and 3 sessions in a week. That means in a week, we have to provide 3 sessions of treatment, and average treatment duration will be minimum 30 minutes. So why physiotherapy required after having PRP therapy? So very important. So PRP therapy can regenerate the degenerative articular cartilage or structure damage within joints. That means if due, it will develop the damaged cartilage again. Regeneration will be started there. Okay, within the inside, inside the joints, if articular cartilage has damage, the PRP therapy can regenerate this. PRP can alleviate pain, but cannot improve mobility along with functional ability. So if somebody have a PRP, patient may feel the of pain, but the mobility would not be increased up to the expectations. So if there is no mobility up to the expectations, if there is no functional mobility, then people or patients cannot do the ADLS normally. So after having the PRP, if we give the physiotherapy, those will improve the mobility, those will improve the functional ability, these kinds of physiotherapy. So patient will get the full recovery. Cannot improve, this PRP cannot improve muscle strength. Yes, it's true, PRP cannot improve the muscle strength, which is the major concern of failure of PRP treatment for the osteoarthritis. What does this failure? If somebody take the PRP therapy and after a few months, patient will complain again, yes, I am feeling pain and I cannot walk properly and I am feeling the weakness to my knees. So after having the PRP, if we provide the strength training as a physiotherapist, so patient will develop the muscular power. They will develop the muscle strength at the surrounding muscle at the knee, and patient will be able to walk and can return to the functions also. And PRP cannot normalize the gait patterns. So if someone has the abnormal gait pattern due to having the osteoarthritis, if that patient take PRP therapy, patient would not be able to walk normally because already patients develop the abnormal gait patterns. So here is the major rule as a physiotherapist, you can play a major role to normalize the gait pattern. So we have to start the gait training. So I'll demonstrate some practical in front of you to make you better understandable how we'll provide the physiotherapy treatments for the osteoarthritis of knee after having the PRP. So now I'll arrange my setup here. I'm taking a minute. So I'm requesting my, I have two models in front of me to demonstrate the treatment regimen here. So I'm requesting my model to demonstrate the strengthening exercise. I mean, not only strengthening exercise, those treatment is required, or we can patients after having the PRP therapy for the betterment of the patients, that treatment I will demonstrate in. I am showing you I'm moving my camera towards my model. So it's a bit difficult to observe, but I am making it. I'm trying my best to demonstrate in front of you. So can anyone tell me, is it visible to you? Can anyone tell me, is visible to you my model?
Yes. Yes, sir.
Yes,
Definitely.
yes.
So I'm requesting to my model. I'm requesting to my model to demonstrate the strengthening exercise for the osteoarthritis, strengthening exercise for the quadriceps muscles. So patient should be in lying positions, I mean supine lying positions, and the clinician will put a pillow just beneath, I mean underneath to the knee, and my model, I will instruct to my patients to pressure to the pillow by using the knee and have to count for at least 10 to 15 seconds. So after counting, then patient will release the pressures, and we have to perform this for 10 repetitions. I'm not showing 10 repetition here, one is enough. So next, technique is joint play technique. So now I will demonstrate the joint play techniques. I'm requesting to my model, please demonstrate a joint play technique to my patient's right knee joints. So my patient will be in a lying position, supine lying positions, and the clinician should be sit just in front of the affected knee, and clinician will hold the upper portion, I mean upper part of the tibia, and have to put the both thumb over the tibial tuberosities. Joint play technique. Okay, by keeping the traction, they will do the vibratory
Excuse me,
motion.
sir.
Do the vibratory motion.
Sir,
It's
sorry to
difficult to
disturb you,
observe,
but your
but we are
tempo is
trying.
not
So I
properly.
have to do the vibratory
giving.
motions, 6 repetitions. So it will improve the joint mobility and will reduce the pain also. So now I'm requesting to my model to demonstrate the mobilization with movement techniques. It's a Mulligan approach. It will increase the range of motion of the knee and will decrease the pain. So patients should be in standing positions if possible, and therapist, clinician will stand beside the affected knee and they will use a Mulligan belt. The belt should place just below the knee joint, and clinician will hold the lower thigh to the opposite directions. And now we have to instruct our patients to do the squatting movement. It's called semi-squat. Along with the squatting movement, the clinician should go down. So this should be continue 6 repeats. Okay. So now come to the second, the knee joint mobilizations. So it will improve the joint range of motions and also will reduce the pain. So patient should be in supine lying position. And I'm requesting to my model to demonstrate. So clinician will use a towel and patient knee should be 60° to 90° flexion on the couch. And the clinician will use a towel to do the mobilization to the knee. The both sided he's doing a one-sided mobilization, and I'm requesting you to do the another side of mobilization. Okay. So the pendulum exercise. So if patient have a lot of pain, I would not able to walk or stand that time to relieve the pain and to improve the mobility, we can advise the pendulum exercise. So for pendulum exercise, we'll recommend, advise our patients to sit on a high couch as the patient's foot is hanging, not touching to the floor. Look. So my patients, I am requesting you to do the pendulum exercise to your one knee. Look, it's moving. It should be move freely. And if patient is able to move freely, so we can use some added weight, or we can hold the foot towards the gravity, So I'm requesting to my model to put the foot towards gravity and make the pendulum. Yes, like this. It will keep some traction forces also. So next one is the gait reeducation. So if patient has a problem with the gait, if somebody has the abnormal gait pattern, then we can start the gait reeducation. So if gait reeducation is needed for people who are working with the abnormal gait on low. So these were my practical sessions. I'm a demonstration. I'm sorry I could not show you very properly. It's difficult to show through the online because I tried to use the live demonstrations. So I have completed my sessions. It's my sharing sessions. If you have any questions, you can ask me.
Thank you very much, sir. It's very informative. If anybody have doubts, you can put on the chat or raise hand so we can ask from sir.
Is there any question?
Still not, sir. If you have any questions, please put on the chat so then we can discuss further. So there's a question. Sir, PRP can be used in RCT surgery had done, but after 6 months, patient had mild pain, mainly supraspinatus origin muscle. It can be used.
Okay, thank you for.
Sir, your mic was muted, sir. Still it's muted, sir. Sir, your mic was still muted.
Hi. Hi, Dr. Mustafa. How are you? Actually, it's a nice presentation.
Sir, your mic was muted. We can't hear you.
A minute. Now you can able to hear.
Okay.
Sorry, is it audible to you?
Now it was audible, sir.
Okay, can you repeat the question, please?
The question was, sir, just give me a minute.
Please.
Sir, PRP can be used in rotator cuff surgery, I think so, had done, but after 6 months, patient had mild pain, mainly supraspinatus origin muscle. It can be used.
Yes. We can use the PRP therapy to the rotator cuff injury also. But after having the PRP to the condition, we must have to apply the physiotherapy. So what sorts of physiotherapy we need to apply? We have to focus on the strength training. What is happening after having PRP? If somebody take the PRP, patients will feel better. I mean, patient's pain will go. So, but it will not improve the strength. So if patient does not have pain, patient will do all kinds of activity that times.
Okay, sir.
So if patients is doing all kinds of activity, that time what will happen, the muscle strength will go down. I mean, wasting will happen there. So if you will find a lot of studies in PubMed, I mean, PubMed and Scopus also, they are showing if somebody take the intra-articular injection, I mean, the steroid, cortisone, PRP, or hyaluronic acid, they might develop the wasting of the muscles. So we have to focus on the strength training. We can start with the isometric and later we'll progress to the eccentric strengthening. So in worldwide, the eccentric strengthening is very popular right now to develop the muscle strengths. So in that conditions, we can use the PRP, and after having PRP, we must have to apply the physiotherapy treatments.
Sir.
Is there any question?
Yes, sir. There are 3 questions. And the second question is, at what stage of OA we can use the mobilization? At what stage of osteoarthritis, we can use the mobilization?
Okay, well, in osteoarthritis, in case of the grade 1, grade 2, I mean mild to moderate stage, we can use the mobilization. But in case of stage 3, I mean the severe stage of osteoarthritis, we can also use the mobilizations. Depends how much force you are giving. That means mobilization has 4 stages. If you talk about the Maitland mobilizations, there are 4 stages. So stage 1 and stage 2, we are using to relieve the pain. And the stage 3 and 4, we can use to improve the range. If we think about the severity of the osteoarthritis, then to the severe cases, we should not use the stage 3 and stage 4. We can use the stage 1 and stage 2 mobilizations.
Okay, so the next question is, sir, commonly I saw osteoarthritis patient with Baker's cyst. Can you tell us any physiotherapy management for that?
Yes, definitely. So Baker's cyst is a common complication of osteoarthritis. So if patient have the osteoarthritis might develop the Baker's cyst, so it's very difficult to manage by the orthopedician also. So orthopedician is doing what? They are trying to aspirate the fluid from the Baker's cyst. They are trying to aspirate the fluid, but if they're doing the aspirations after a few days or weeks, the cyst will be filled by again you will find the fluid. So physiotherapist is doing what for the Baker's cyst management? So we have to use the soft tissue techniques, some pressure bandage, and some lymphedema management. So we can use the lymphedema management here. By these, we can manage the Baker's cyst also. And the joint play technique is very effective to management for the Baker's cyst also. Try for the joint play technique and pressure garments bandage and lymphedema. Next question.
Next question is, sir, for patient with abnormal gait due to knee osteoarthritis, to what extent can standing and weight bearing be helpful to them?
Can you repeat the question, please?
So he was asking the patient with knee osteoarthritis, how the weight bearing exercise in standing will help. Shall I repeat it, sir,
my
again?
connection is maybe problem. So I'm not audible to you. I'm not hearing.
I can hear you, sir. Can you hear it now, sir?
Can you hear me?
We can hear you, sir.
Yes, please.
Okay. For patient with abnormal gait due to knee osteoarthritis, to
Yes.
what extent can standing and weight bearing be helpful to them?
Yes, for patients with abnormal gait due to knee osteoarthritis, to what extent can standing and weight bearing be helpful to them? Yes. So if patient has the patient has the osteoarthritis in a stage of 1 and 2, I mean grade 1, grade 2, if patient do the weight bearing on even surface, then it will stimulate the articular cartilage and the synovial fluid also. The exchange will be improved, the nutrition within the joint will be improved. But if patient is trying to work on uneven surface, like they are walking, I mean staring up, they are walking in the heel track area, is difficult to work. So with the abnormal gait, we have to try to correct the gait pattern first. So we have to do the biomechanical gait analysis. So what sorts of gait deviation is there? We have to try to manage this gait deviation first. After that, we can start the others remedy also. But in case of severe osteoarthritis, we should avoid the weight bearing with the abnormal gait.
Okay, the next question is, sir, what is the difference between physiotherapy treatment after giving PRP and surgery for osteoarthritis? Is it same procedure or not?
Okay, what is the difference between physiotherapy treatment after giving PRP and the surgery for osteoarthritis? Yes, is different, because if somebody have a PRP therapy, so they can work immediately. But if somebody have the surgery, they cannot work immediately. So we have to give the post-operative physiotherapy management to the patients who have the knee surgery. But if somebody have the PRP, then we can start the physiotherapy after 72.
Okay,
Next
sir.
question, please.
That's all, sir. Thank you very much, sir. That's wonderful session.
Thank you, Dr. Mustofa, for that valuable addition to the World Physiotherapy Day celebrations.